What if I told you that the humiliating midnight bathroom trips, the weak flow that makes you feel less of a man, and that burning sensation that's stealing your dignity could all be caused by something as simple as missing vitamins in your body? You probably think these problems are just part of getting older, that you have to accept this slow decline of your masculinity. But here's what's even more alarming. Recent research reveals that over 80% of men suffering from prostate problems are completely unaware. They're dealing with preventable vitamin deficiencies, not inevitable aging. While you're lying awake at 3 a.m. wondering if you'll need surgery or if this will get worse, your body is desperately crying out for 5 specific nutrients that could restore your strength, your sleep, and your confidence. For centuries, traditional healers understood that certain natural compounds could protect men from prostate decline and maintain their vitality well into their golden years, wisdom that modern medicine has largely abandoned. Ancient cultures recognized that when men consumed specific nutrient combinations, they maintained strong urinary flow and uninterrupted sleep throughout their lives. But today's processed food supply and medical system have left millions of seniors completely defenseless against what our ancestors prevented naturally. Traditional healers warned that without these protective nutrients, men would experience the exact symptoms plaguing modern seniors: frequent urination, weak flow, burning sensations, and gradual loss of masculine strength. Groundbreaking research from PMC reveals that men over 60 who corrected just 5 vitamin deficiencies experienced dramatic improvements in prostate volume reduction and urinary symptoms within months, with many reporting their first full night's sleep in years. Even more shocking, the same studies found that these vitamin deficiencies are present in nearly every man experiencing prostate problems, yet most doctors never test for or address these critical nutritional gaps. What's most alarming is that this peer-reviewed research proves these aren't just minor improvements. Men reported feeling their masculinity and confidence return, something most believed was gone forever. I'm Dr. Sarah, and I need to share some potentially life-saving information about prostate health that could completely transform your quality of life and restore the dignity you thought was lost forever. What you're about to discover could end those exhausting midnight bathroom trips and bring back the strong, confident man you remember being. Subscribe now, because this video reveals shocking new research about 5 specific vitamins that could save you from unnecessary suffering and restore your masculine vitality immediately. Before we dive in, tell me, where are you watching from today? Have you been struggling with frequent nighttime urination or weak flow? If this is your first time here, don't forget to subscribe for more life-changing health revelations that could prevent years of unnecessary decline and suffering. Today, I'm going to share 3 critical insights that could transform your relationship with your prostate health. First, you'll discover why vitamin deficiencies, not inevitable aging, are often the real culprit behind those exhausting midnight bathroom trips and weak urine flow. Second, I'll reveal exactly which 5 vitamins work together like a perfectly coordinated team to restore your masculine vitality and confidence. And third, you'll learn a simple approach that many of my patients use to regain the strong, uninterrupted sleep they thought was gone forever. Let me start with something that may truly stop you in your tracks. If you're over 60 and find yourself waking up all night to use the bathroom, straining with weak urine flow, or quietly feeling your masculinity slip away, I want you to hear me clearly. This is not just age. After working with thousands of men in my practice, I've learned that what we call normal aging often masks simple, correctable nutritional deficiencies. Your body's plumbing system, your urinary tract and prostate requires specific vitamins to function properly, just like your home's plumbing needs the right water pressure and clear pipes to work smoothly. When these essential nutrients are missing, your prostate can become enlarged and inflamed, creating pressure on your urinary system much like a clogged pipe restricts water flow. The result? Those frequent nighttime interruptions, that frustrating weak stream, and the gradual erosion of confidence that so many men experience. But here's what gives me hope, and what should give you hope too. In my practice, I coordinate closely with my patients' doctors, and together we've seen remarkable improvements when men address these specific vitamin deficiencies. The research backing this approach continues to grow stronger each year. The first essential vitamin, vitamin D, your prostate's silent protector. The first vitamin every man over 60 must understand is vitamin D. I call it the silent protector because while most people think of it only for bones or immune health, inside the prostate, it plays a much deeper and more powerful role. Think of vitamin D as your body's master plumber. Just as a skilled plumber keeps your pipes running smoothly and prevents blockages, vitamin D helps regulate your prostate tissue, keeping inflammation under control and maintaining healthy cell function. Recent research from PMC reveals something remarkable. Men over 60 who corrected vitamin D deficiencies experienced significant improvements in prostate volume reduction and urinary symptoms within months. Many reported their first full night's sleep in years. What's most striking is that vitamin D deficiency was found in nearly every man experiencing enlarged prostate symptoms. Here's the deeper science made simple. Your prostate contains vitamin D receptors that act like tiny switches. When you have adequate vitamin D, these switches help maintain normal cell growth and keep inflammation in check. When you're deficient, those switches can't function properly, and your prostate tissue may begin to enlarge, putting pressure on your urinary system. Let me share Kenneth's story, a 68-year-old retired electrician from Michigan who came to me already working well with his urologist. Kenneth was married to Carol for 40 years and loved spending time in his woodworking shop with his 3 grandchildren. What he wanted was to sleep through the night without those constant bathroom trips that were leaving him exhausted and irritable. Kenneth's doctor and I coordinated to check his vitamin D levels, and we discovered he was severely deficient. Together, we added appropriate vitamin D supplementation to his routine, with his urologist monitoring his progress. Within 3 months, Kenneth noticed he was waking up only once per night instead of 4 or 5 times. His doctor was pleased with the improvement in his urinary symptoms and how actively Kenneth participated in his wellness plan. Today, Kenneth continues both his medical care and vitamin D supplementation, sleeping peacefully and feeling like his energetic self again in his workshop. I'd love to hear about your experience with frequent nighttime urination or weak flow. Have you found approaches that work well with your medical care? Share your story in the comments. I read every one. And your experiences help other viewers understand they're not alone in this journey. When working with your doctor to evaluate vitamin D for prostate health, ask about the 25-OHD blood test. This shows your true vitamin D status and helps determine if supplementation might benefit you. Most healthcare providers appreciate when patients come prepared with research-based questions about natural approaches to support their treatment plan. The second essential vitamin, vitamin E, your antioxidant shield. Let's talk about vitamin E, the antioxidant shield that protects your prostate's delicate plumbing system. Over the years, I've seen countless men walk into my office carrying not only the burden of prostate problems, but also the frustration of feeling like nothing works. One of the hidden reasons for this is something I call silent rusting inside the body. Just as rust corrodes your home's pipes over time, creating blockages and weak water pressure, oxidative stress from free radicals damages your prostate tissues. This cellular damage leads to inflammation and contributes to benign prostatic hyperplasia, that enlarged prostate that's disrupting your sleep and stealing your confidence. Vitamin E acts like a protective coating inside your body's plumbing system, preventing that damaging rust from forming and keeping your prostate tissues healthy and flexible. Natural forms of vitamin E, particularly the mixed tocopherols, provide the most effective protection against this oxidative stress. The research I find most compelling shows that men with adequate vitamin E levels maintain better prostate health as they age. But here's what's crucial. Synthetic vitamin E doesn't provide the same protective benefits as natural forms. Your body recognizes and uses natural vitamin E much more effectively, just like quality pipe materials last longer than cheap substitutes. In my practice, when patients work with their doctors to ensure adequate vitamin E intake through diet and appropriate supplementation, they often report feeling less inflammation and discomfort in their pelvic area. The improvement in their overall urinary function frequently follows. What questions would you ask your healthcare provider about adding natural antioxidants like vitamin E to your prostate health routine? Comment below your questions, help me create better content, and guide how I explain these important topics to my patients. If you're considering vitamin E supplementation, discuss this with your doctor first, especially if you take blood-thinning medications, as vitamin E can enhance their effects. This coordination ensures you get the protective benefits safely. The third essential vitamin, vitamin C, your inflammation fighter. But here's what surprised me most about prostate health: the role of a vitamin most men completely overlook. If there's one word I hear more than any other when men describe their prostate troubles, it's burning. That uncomfortable burning sensation during urination, that feeling of irritation that never quite goes away. That burning has a name: inflammation, and it's one of the most damaging forces working against your prostate health. Think of inflammation like a small fire smoldering inside your body's plumbing system, creating heat, irritation, and damage to the surrounding pipes. Vitamin C acts like water on that fire. It's your body's natural inflammation fighter, working to cool down the irritated tissues and support healing. But vitamin C does something else remarkable for men with enlarged prostate symptoms. It strengthens your bladder walls through collagen support. Here's the simple science. Vitamin C is essential for collagen production, and collagen provides structural support to your bladder and urinary tract. When these tissues are strong and healthy, they function more efficiently, leading to better bladder control and more complete emptying. Recent evidence from Healthline medical reviews confirms that diets rich in vitamin C support prostate health by reducing inflammation. Men who maintain adequate vitamin C levels through both food sources and supplementation often experience less burning during urination and improved overall comfort. If this information has been helpful so far, please hit that subscribe button so you don't miss what I'm about to share next. It's about a vitamin that most doctors rarely discuss, but it could be the missing piece of your prostate health puzzle. Your healthcare provider can help determine if vitamin C supplementation fits with your overall health plan, particularly if you have kidney issues or take certain medications. This collaboration ensures you get the inflammation-fighting benefits while protecting your overall health. In my clinical experience, men who work with their doctors to address both the inflammatory component of their prostate problems and the structural support needs of their urinary system often see the most comprehensive improvement in their symptoms. The fourth essential vitamin, vitamin K2, your quiet traffic director. In a moment, I'll share the mistake most people make when trying to support their prostate health naturally. But first, let me tell you about one of the most overlooked vitamins in men's health, vitamin K2. K2 works like a quiet traffic director inside your body's plumbing system. Its main job is to tell calcium exactly where to go. Calcium belongs in your bones and your teeth, not in your prostate or your blood vessels. But without adequate vitamin K2, calcium starts depositing in soft tissues where it doesn't belong, including your prostate. Think about what happens when mineral deposits build up in your home's pipes. The water flow becomes restricted, pressure drops, and the whole system struggles to function properly. The same thing happens in your body when calcium accumulates in prostate tissues without proper K2 direction. This process, called calcification, can contribute to prostate stiffening and enlarged prostate symptoms. Vitamin K2 prevents this calcium buildup, while ensuring calcium goes where your body actually needs it, strengthening your bones, which is especially important for men over 60. Here's where it gets interesting. Vitamin K2 works synergistically with vitamin D. While vitamin D helps your body absorb calcium, K2 directs that calcium to the right locations. Together, they maintain the flexible, healthy function of your entire urinary plumbing system. However, there's a critical safety consideration I must emphasize. If you take blood-thinning medications like warfarin, vitamin K2 can interact with these drugs. Always consult your healthcare provider before adding K2 supplements to your routine. This coordination is essential for your safety and ensures the best possible outcomes. The research supporting K2's role in preventing soft tissue calcification while supporting bone health is well documented. In my practice, when patients coordinate with their doctors to ensure adequate K2 intake, they often report feeling like their body has loosened its grip, less stiffness, improved flow, and better overall comfort. The fifth essential vitamin, B-complex, your energy and circulation boost. When I sit down with older men struggling with enlarged prostate symptoms, one of the most common complaints I hear isn't just about weak urine flow or nighttime bathroom trips. It's about energy. They feel drained, exhausted, and wonder if this constant fatigue is connected to their prostate problems. The answer is yes, and B-complex vitamins are often the missing link. Think of B vitamins as your body's spark plugs. Just as spark plugs provide the ignition your car engine needs to run smoothly, B vitamins provide the cellular energy your entire body requires to function optimally. When you're deficient in B vitamins, everything slows down, including the circulation to your prostate and the energy your body needs for proper healing and maintenance. B6, B12, and folate are especially vital for men over 60. Together, they help lower something called homocysteine, a compound that, when elevated, damages blood vessels throughout your body, including the tiny vessels that supply your prostate with nutrients and oxygen. Here's the simple explanation. Good circulation is like having proper water pressure throughout your home's plumbing system. When circulation is compromised due to damaged vessels, your prostate doesn't get the nutrients it needs to stay healthy, and waste products don't get cleared out efficiently. According to Harvard Health Publishing, B vitamin deficiencies are common in older men due to changes in absorption as we age. When these deficiencies are corrected through diet and appropriate supplementation, many men report not just improved energy levels, but better overall urinary function and less prostate-related discomfort. But here's what's most encouraging. B vitamins support your body's natural healing processes. They help repair damaged tissues, support healthy cell division, and maintain the nervous system connections that control bladder function. It's like giving your body's maintenance crew the tools they need to keep your plumbing system running smoothly. B. Vitamin deficiencies are common in seniors due to absorption changes that occur naturally with aging. Your doctor can test your B12, folate, and homocysteine levels to guide appropriate supplementation and ensure these vital nutrients are supporting your prostate health and overall vitality. The path forward. How these 5 vitamins work together. What I'm about to tell you changed how I practice medicine and how I help men regain control over their prostate health. After more than 3 decades of listening to men share their struggles, I can tell you with certainty your frequent urination, weak flow, and loss of masculine vitality are not just the cruel hand of aging. They are often the result of your body quietly missing what it needs to stay balanced and strong. These 5 vitamins work together like a perfectly coordinated maintenance team for your body's plumbing system. Vitamin D acts as the master regulator, keeping inflammation in check and maintaining healthy tissue function. Vitamin E provides protection against damage, like a protective coating preventing rust and deterioration. Vitamin C fights inflammation and strengthens structural support, like reinforcing the pipes themselves. Vitamin K2 directs calcium to where it belongs, preventing harmful deposits that could restrict flow. And B-complex vitamins ensure everything has the energy and circulation needed to function optimally, like maintaining proper pressure throughout the entire system. In my practice, I've worked with men who started addressing these nutritional gaps in coordination with their doctors, and many have experienced remarkable transformations. They've regained their sleep, restored their confidence, and reclaimed the energy they thought was gone forever. The wonderful thing about this approach is that it works with your body's own wisdom, not against it. These aren't harsh medications with concerning side effects. These are nutrients your body is designed to use for optimal function. Here's exactly how to begin supporting your prostate health naturally. First, discuss this approach with your healthcare provider. Share what you've learned today and ask about testing for vitamin D levels, B12, folate, and homocysteine. Most doctors appreciate when patients take an active interest in their health and come prepared with research-based questions. Second, consider a comprehensive nutritional assessment. Your doctor can help identify which specific deficiencies might be contributing to your prostate symptoms and guide appropriate supplementation. Third, focus on whole food sources when possible. Fatty fish, leafy greens, colorful vegetables, and quality proteins provide many of these nutrients naturally. Supplements can fill gaps, but real food should form the foundation. Fourth, be patient with the process. Most of my patients notice improvements within the first few months, but lasting change takes time. Some men feel changes sooner, others take longer. Both are perfectly normal. Fifth, maintain consistency. Gradual, steady progress creates lasting results. Small daily choices have the power to heal and restore function in ways that surprise both patients and their doctors. Remember, These nutritional approaches work best as part of a comprehensive health plan developed with your healthcare team. Your doctor can evaluate your individual needs, monitor for any medication interactions, and ensure these natural approaches complement any existing treatments you may need. If this evidence-based approach resonates with you, please subscribe for more wellness education that honors your relationship with your healthcare provider. Remember, I'm here to educate and support your journey, not replace your doctor's expert care. If this reminds you of someone who might benefit from this information, perhaps a friend or family member struggling with similar prostate concerns, please share this video with them. Sometimes sharing knowledge is the kindest gift we can give to people we care about. The research continues to build supporting these natural approaches to men's health. What gives me the greatest satisfaction in my practice is seeing men regain not just better sleep and urinary function, but their confidence and sense of masculine vitality. You deserve to feel strong, energetic, and in control of your health. Next week, I'll be sharing the 5 foods that naturally support prostate health and the 3 common foods that may be making your symptoms worse. It's practical information that many of my patients say transformed their daily comfort and energy levels. Until then, remember, your health is your most valuable asset, and taking charge of it through education and partnership with your healthcare team is one of the wisest investments you can make.